So I want to talk about the numbers first. So the most recent numbers through the American Cancer Society is that there's an estimation that there's 14.5 million cancer survivors, and it's estimated that by year 2024, there'll be 19 million. And this is largely due to earlier treatments or earlier detection and better treatments. So people are living long lives with cancer. And what strikes me about those numbers is that those are pretty high numbers, and it makes you stop and think about how many caregivers does that represent. Oftentimes, caregivers are family members, and 83% of caregivers who are polled identify as a family member. Some other numbers: caregivers provide 75 to 80% of care. That's really, really high. And that adds up to about 8.8 hours of care a day, which, think about that, that's a full-time job. And 70% of caregivers report also being in the workforce. So those caregivers who are working jobs are also coming home and still providing, another full-time job of care. And on average, about 4 years of caregiving. So who are caregivers? It's really anybody who provides a level of emotional, physical, or practical support to somebody experiencing cancer. Caregivers are a vital part of the healthcare team, and they play a really important role in improving the patient's health and their treatment, and also with the caregiver's or the patient's quality of life. 60% of caregivers are female, and on average, looking at about 49 years old. The caregiving that we're talking about tonight is informal caregiving. So it's unpaid, not trained for the caregiver job. And it's reported that about 1 in 3 caregivers have no additional help, either hired help or unpaid help. So the role of caregivers, as we talk about caregiving in the context of cancer, the roles and tasks and responsibilities really change throughout the various stages of cancer survivorship. So during diagnosis, the roles and the challenges that a caregiver may provide are, the emotional coping of dealing with the initial shock of dealing with a cancer diagnosis and gathering information to understand the diagnosis and the treatment options that are available. And then some of those roles and responsibilities may shift to something different during treatment. Maybe at that time, the primary responsibility is getting to the treatments, helping your loved one tolerate the treatments, dealing with the side effects that they may be experiencing during treatment. And then moving into post-treatment and long-term survivorship, this is a phase where oftentimes it signifies that we should be celebrating, that we made it through treatment, that the tough part is behind us. And what we know is that's not really always the case, that post-cancer is when folks oftentimes are struggling with some long-term side effects of their treatments, maybe some physical changes that they've experienced because of their type of cancer or the treatments that they've had. Sometimes the emotional coping doesn't settle in until after you've gone through treatment. And so the role of the caregiver kind of shifts and is focused on still supporting the cancer patient much beyond the treatments. And then roles also shift too with cancer recurrence. Sometimes there's a lot more emotional coping and support that happens at that point, and making decisions about what to do with treatments, with different recommendations, and then also with palliative care and end of life, roles also shift and decisions change at that time as well. So what do caregivers do? You all know what you do, and this is just a snapshot of things that caregivers manage and provide. Just kind of threw up some major ones. Company to medical appointments, providing support with the day-to-day needs, managing medical problems, dealing with finances, dealing with insurance claims, communicating with oncology team. A lot of times the caregivers are kind of at the front line with reporting symptoms or changes in their loved ones' coping or physical care, maintaining home and doing laundry and running errands, and also while doing all of this stuff while managing the needs of other people within the family. So whether that's extended family or children or parents, caregiving continues. The one thing that struck me too is that increasingly caregivers are providing care that nurses used to typically provide. A lot of care is done now in the home. So that's with injections, maybe that's managing tube feeds or managing a catheter or colostomy care. These are all things that, if you're not a nurse, a trained nurse, can be very overwhelming and scary. So it kind of strikes me that, we're throwing family members and caregivers into these roles.